All right, we've got House File 1918, Representative Ryer, and the motion there, Representative Ryer's motion, is that House File 1918 be laid over for possible inclusion in the finance bill. Representative Ryer.
Thank you, Madam Chair and committee members. House File 1918 focuses on establishing the dental home concept to improve access to dental care for public program members, especially children. This idea has wide support from the governor to the Department of Health to the critical access dental provider community who were instrumental in drafting this legislation. I'm pleased to present it to you today. As we heard in Mr. Matt Anderson's briefing last month on Medicaid and Minnesota Care dental programs, Minnesota has long-standing access problems. I'll remind you of one data point. The share of kids getting dental care on medical assistance, less than 40%. This is a core health and equity problem that we are obligated to address for both practical and moral reasons. We also have a reimbursement problem. Minnesota comes in 49th in reimbursing providers for providing care to medical assistance members, and we have an extremely complex administrative and rate system. Within this environment, many proposals have been advanced to try and attract more providers through rate increases and administrative simplification. This includes proposals to eliminate the Critical Access Dental, or CAD program, which pays CAD providers an added 37.5%. That funding would be put into the overall base rate in hope of enticing additional dentists to treat more Medicaid enrollees. This raises concerns among the CAD providers who currently serve a majority of Medicaid patients, as shown in research conducted by Appletree Dental, Community Dental Care, and HCMS's dental clinic. So about a year ago, a group of CAD dentists began meeting to consider options for creating an alternative incentive program that was aligned with DHS's goals of continuity of care and a value-based system. These meetings were also referenced in Mr. Anderson's overview last month. The group settled on a dental home model because of the success of medical and behavioral health home models. These are best described as an approach to care that is patient-centered, comprehensive, team-based, coordinated, accessible, and focused on quality and safety. Dental homes are not necessarily buildings or places. They extend beyond the walls of a clinical practice. These dental homes will build partnerships with clinical specialists, families, and community resources by providing care to populations within community settings and using innovative workforce models in places like schools, shelters, group homes, and congregate living. This approach also lends itself to culturally specific care and helps address disparities in health outcomes. This is a promising approach to solve this enduring problem. By passing House File 1918, we authorize an advisory committee to develop recommendations for a dental home pilot, and recommendations are due by December 15th, 2021. This will be a focused group encompassing all providers, stakeholder groups working together to help us move forward in delivering the care our MA and Minnesota Care members deserve. In closing, I want to acknowledge the work these dental providers have done this past year and their passion for caring for Minnesota Healthcare Program enrollees. Next, I'd like to invite Dr. Sheila Riggs to testify. Dr. Riggs is the chair of primary dental care at the University of Minnesota's School of Dentistry. She also happens to be my constituent. She has chaired the large overall group this year to develop an outline of what a dental home could entail. Thank you. I'll look forward to your questions and ask for your support.
All right. Well, thank you so much, Representative Ryer and Dr. Riggs. Dr. Riggs is familiar to us here in this committee, or in previous years at least. So welcome, Dr. Riggs, and glad to have you with us. Please go ahead.
Thank you, Madam Chair and members of the committee. For the record, my name is Dr. Sheila Riggs, and I chair the Department of Primary Dental Care at the University of Minnesota School of Dentistry, and I chair the Dental Services Advisory Council within the Department of Human Services also. I want to start by thanking my state rep, Representative Ryer, for authoring this important legislation For several years, the Critical Access Dental Program has been at the center of the debate over how to increase access to oral health care for individuals on Minnesota's public programs. About 15 months ago, I convened a large group of us CAD or critical access dental providers after a few providers purchased data from DHS. It showed that fewer than 300 of us CAD providers in the state account for over 2/3 of the Medicaid enrolled dental workforce. We all agree that elimination of the CAD program without something designed to replace it would put the entirety of the safety net provider community in financial peril. However, while the safety net provider community absolutely relies on the CAD program to keep its doors open, we also understand that not enough people are able to access care, and we need to evolve in order to better serve Minnesota. That's why we have brought forward this legislation. We believe a dental home delivery model would meet the oral health needs of Minnesotans while also providing the provider reimbursement that is based on the care they provide and the outcomes we all achieve. A patient-centered dental home is a model of care that is accessible as it allows for multiple entry points into care for the enrollee and uses the entirety of oral health workforce in innovative ways to ensure continuous and coordinated care that is patient and family-centered. Our new coalition, the Minnesota Dental Homes Collaborative, is committed to working with the Department of Health and the Department of Human Services and other stakeholders to develop dental home pilot projects with many elements and strategies that will need to be demonstrated and evaluated. This development process should be deliberate and data-driven. We need to improve access to dental services and improve outcomes through evidence-based innovations, workforce changes, a more suitable and ethical benefit set to improve oral enrollee health while demonstrating value for taxpayer dollars. Lastly, while we are incredibly excited about the prospects of the dental home concept, we know it's going to take time to develop and pilot and implement. As we work through the process, we believe that the Critical Access Dental Program remains vital to preserving patient access and clinical infrastructure. Thank you for the opportunity to testify today. I'd be more than happy to answer any questions any of you might have.
Well, thank you very much, Dr. Riggs. We appreciate your testimony. Members, are there any questions? Okay, not really seeing any. This is great. Representative Ryer and Dr. Riggs and the others who have been working on this, I really appreciate this. We've been struggling with this issue. As members who've been here know that this is a constant struggle, and it's a struggle for our state of how we can do better with getting dental care and improving the dental health of the people on our public programs. So I really appreciate your work. Representative Bierman.
Thank you, Madam Chair. I couldn't find my hand raised there for a minute, so thank you for waiting. I just wanted to thank Representative Ryer for getting to work on this and getting a bill up and having an option. You know, the statistics that you talked about at the beginning of us being 49th in the 50 states under this is just an important statistic that I think we need to find ways to improve that immediately. And I think this pilot program, you know, is something that we should be looking at to try and to see how that could work out. And just the question I had was this pilot plan that Dr. Riggs referred to a number of elements of it. My question is, were you borrowing anything from other states, or is this sort of just a Minnesota grown plan based on your experience and the experience of the stakeholders gathered?
So, Dr. Riggs, do you want to take that? I don't, or Representative Ryer can. Okay, Dr. Riggs.
Yeah, so there's no perfect dental home model upon which to draw. There is some evidence that we will be bringing in as threads as we design, but we really do believe it's going to be more Minnesota-based because we have the workforce innovations that so many other states don't have. So we will absolutely be using the evidence that's available, but making it a Minnesota style.
Just one follow-up, Madam Chair. So then, you know, the providers are out there right now. I've seen, you know, examples of some really innovative clinics that are really treating a lot of people in very imaginative ways. And my question is, as you think about this pilot program, would you try to sprinkle it throughout the state, or were you thinking just like a couple to try them out to start? Small scale or large scale?
Dr. Riggs.
Well, I think that's to be determined. I think a part of the architect work group will be about designing the pilots. And we actually think that what we'll find that a lot of the clinics you know of are doing some really innovative things. So it may become really just demonstration projects that evaluate some of the innovations already. And so that's why we think of it, yes, as a pilot program, but there's a lot of elements that will need to be tested and evaluated.
Thank you, Dr. Riggs. Thank you, Madam Chair.
Okay, thank you, Representative Bierman. Representative Backer.
Yeah, thank you, Madam Chair. This is a question for the author or maybe one of the testifiers. I understand the American Academy has been, AAPD has been using this model or have been recommending this for 2 decades or several decades, but do we know of any dentists in Minnesota that has already utilized this model? And I mean, it seems like a very good idea, but if they haven't, what's been the roadblock for this? Because obviously we want to give good care to children, we get that, but has someone been able to utilize this? Are we working from that utilization? And if not, what do you think has been the roadblock? Thank you. That's my only question, Chair.
All right. I see Ms. Erickson is here as well. I don't know who wants to answer it. Ms. Erickson, did you want to try to answer that? All right, welcome.
Thank you, Madam Chair, members of the committee. For the record, my name is Tara Erickson, and I am the contract lobbyist for Dental Access Partners. Thank you, Representative Becker, for your question. I think some of the current critical access dental providers are doing a lot of the work right now that could be seen as a dental home model. They are doing hub and spoke. They are going out into the community. The problem has been that there are administrative barriers and reimbursement issues that have not been allowed, whether that is collaborative practice dental hygiene within school settings. And so we want to be able to look at this from a very holistic standpoint and say how many different programs are out there that we're not able to utilize right now because of reimbursement issues, and then integrate those into our community so that our enrollees can have many different entry points, again, whether it's schools or other community settings.
Representative Backer.
Thank you, I appreciate it. Just wanted to know some of those details and how we can provide those good level of care. Thank you, that was a good answer, thank you.
All right, well, thank you. Thank you, Ms. Erickson. Okay, so once again, Representative Ryer, thank you for your work on this. You know, I just want to comment, it's really easy to criticize the system we have now, which is not doing very well and hasn't been for a long time. And of course, finding a good solution and a better way to deliver care is the hard part. And thank you to all those who are actually working on trying to find the solution, because we badly need it. We can't have a healthy population with rotting teeth. That we know. So, Representative Ryer, final word.
Thank you, Madam Chair. Thank you, Dr. Riggs and Ms. Erickson for your support in this today. And I just want to say, I feel like right now we have a great opportunity to take innovations from past dental experiences, to Representative Backer's point, to other areas of healthcare, and see what we can do, because we have an opportunity and an obligation to use our state resources well. So thank you all for your support for this.
All right. So with that, House File, let's see, I lost the number here. House File 1918 is laid over for possible inclusion in the finance bill. Thank you.